Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Our top story: India reported 94,052 new COVID cases and 6,148 deaths in the last 24 hours. That's a massive jump in deaths, but that is because Bihar has revised its death figures. It's revised its death tally and added nearly 4,000 more deaths. The positivity rate is 4.69%, and that's the third consecutive day when India's reported positivity rate below 5%. So that's a very good sign there. Now, the big focus on our show is the Delta variant. That's a variant of concern first identified in India, which is believed to be 60% more transmissible than the Alpha variant, which was previously dominant in Britain. That is what a prominent UK epidemiologist has just said. Now, Public Health England had earlier said the Delta variant could be causing more hospitalizations. And here in India, we have said it is more transmissible. Well, to talk about the latest on the Delta variant, we're joined by Professor Ravindra Gupta, Professor of Microbiology, University of Cambridge. Thank you so much for joining us again on the show. So lots of recent reports on the Delta variant. What is the latest that you can share with us?
In the UK, obviously Delta variant is spreading quite rapidly, but of course we have relatively low levels of infection as a country in the whole. We are seeing more hospitalizations. We do see more hospitalizations with the Delta variant. But we haven't seen many severe cases of COVID-19, and that may be because there's high coverage of vaccination. The people who have ended up in hospital usually are not vaccinated, but there are some vaccinated individuals. I don't think it's clear as to whether this virus is more pathogenic or causing more severe disease in the UK at the moment. So I think we have to keep an open mind. It does appear to be more transmissible than. It's spreading faster in the population than the previous virus, the alpha variant or B117. So it does have an advantage. Now, that's either because the virus is able to infect cells more quickly and more rapidly, or whether it's also because of the immune evasion properties, because it does have mutations that allow it to avoid the binding of antibodies that we produce after vaccine.
Now, President Biden also tweeted about encouraging people to get vaccinated, and he mentioned in that tweet that the Delta variant is spreading among those between the ages of 12 to 20 years in the UK. So many younger people are getting this infection?
Yeah, we're not vaccinating young people at the moment, and that's why it's being seen in those groups, which is natural. So that is a good reason for the US and other countries and us maybe to vaccinate younger individuals, because if we want to keep the virus under control in the country, then that's an area where we do need to vaccinate, I think.
Now, in India, we have the Covishield vaccine, which we are using extensively. That's the AstraZeneca vaccine that's being used in the UK as well. We do know that it was made for the original strain. So what does it mean for these variants?
Well, the vaccines were designed, as you said, against the original virus, and these new viruses are able to avoid those vaccines to some extent, but we still get very good protection from severe illness and death. So the other parts of the immune system are still working and doing the right thing. I think in the longer term, we do need to modify the vaccines as we go along, just to get better control of the virus, and that's only natural that we want to do that. Because, of course, some people do not respond so well to the vaccine. There are vulnerable people who, if they get infected, will have a very bad outcome. And so continual surveillance of mutations, understanding how the virus is behaving is also important to inform the new generation of vaccines that we'll be generating.
Now, Dr. Ravi, you've been quoted in the media as saying that you're already seeing the first signs of a third wave in the UK. What is the latest on that? And do you think they will lift restrictions on the 21st of June?
Yes, well, I mean, there is going to be a third wave, and depends how you define a wave. We are seeing an increase in infections. That, by definition, is whatever you want to call it, and it will continue. And if because we have, vaccination has not covered everybody, and we can see this new variant, which is, more transmissible. It spreads faster. It's harder to control, and so the June 21st date may be pushed back by up to a month, which I think is a good idea, because schools will close after 1 month, and if the virus is spreading amongst young people, then we don't want to give it too much more opportunity to do that. And also, of course, It's now summer. We hope that people will be outside more. There'll be less spread from person to person. But I do think we do need to be very careful in the UK. We have a good vaccination coverage so far, but we can maximize the gains by keeping the virus transmission under control.
All right, Dr. Ravi, thank you so much for joining us here on the show again. Well, to talk more about the Delta variant and what it means for us here in India as we're unlocking, the vaccination drive is continuing. We're now joined by Dr. Pavitra Venkatagopalan, microbiologist and coronavirologist. Thank you so much, Doctor, for joining us. So you just heard what Dr. Ravi had to say about the UK's situation and, you know, all this talk of how the Delta variant is more transmissible. We still don't know about, you know, how effective the vaccines are, in the sense, you know, it has been found that the Pfizer vaccine is, you know, its effectiveness goes down with the Delta variant, how it continues to protect us against severe disease, isn't it?
Yes, even not just the Pfizer vaccine, there is initial data to say even Covaxin and Covishield does offer some degree of protection against the Delta variant as well. It's not as per the clinical study was designed. It was based on the original virus variant that was spreading, but this is based on what the current data that we are seeing. So there is a reduced efficacy, but it still does not render it useless at all. It's still quite useful in terms of giving people a reasonable immune response whereby severe disease is avoided.
Right, Doctor, and this it being more transmissible now, where, you know, there are different studies, they say how much more transmissible it is than the original, you know, virus, than the other variant like Alpha, and now how transmissible Delta is. But what we do know for sure that it is more transmissible. We still don't know whether it causes more severe disease. You know, when will we know that for sure? Because we had this devastating second wave, but that was also because of our healthcare, you know, our healthcare system being so burdened.
So there are a couple of ways we can look at it. See, whether a variant is more transmissible or less transmissible, we will study given time. But initial data suggests that it is more transmissible. Now, we know that the vaccine acts with a slightly lower efficacy, so let us control the transmission of it using other well-established means by continuing to mask up and maintain distance. Regarding whether it causes higher number of infections or not, again, see, at least where I am from, a lot of parts of the country, of our country, is still under a lockdown situation. The case numbers are going down quite well. But we'll have to open it up a little bit more to see whether this brings down the second wave or not, or it's just an artificial lull before it starts spreading again when we sort of are losing out on all these restrictions that are in place right now. So whether it will be as devastating or not, we have to wait and see. Let us hope that it is not, with more people getting vaccinated.
That's right. And Doctor, keeping an eye on the variants, doing those genomic studies, that's something that we'll have to be, you know, very efficient about, because that is where, you know, we made the mistake between the first and second wave. We did know there were variants, but, you know, there wasn't so much attention being paid to it. There wasn't so much pressure on doing more genomic studies, and that's what we have to continue, you know, focusing on, isn't it?
So genomic studies are very challenging, and they're very technically difficult to do. So to scale up genomic studies is a lot easier said than done. That being said, disease surveillance is a very important part of keeping a whole nation safe and the people safe as such. So we are ramping up on genomic studies and disease surveillance to ensure we are seeing what sort of variants we are seeing and if we are seeing any new variants. Not just that, analysis of genomic data is also very challenging. We might be seeing a lot of new mutations, but most of them may mean nothing. So what does this mean? Is there a repertoire where we can deposit these genomic sequences? Is there a software that tells us, hey, this is something that we need to pay attention to, this is something that may affect the vaccine efficacy? So these are the things that systems are coming up in place. So we'll give it a little bit of time to catch up, but it's something very crucial that is something we need to invest in and sustain over the future.
All right, Dr. Pavitra, thank you so much for speaking to us, and we'll have you back on the show later to ask you more questions about the vaccines. But shifting to our next focus now on the show, and that's post-COVID care. Now, many people have had COVID in the last couple of months during the second wave of the pandemic, and it's important to focus on post-COVID recovery and how to take care of yourself, as many people are experiencing symptoms that go on for months. Well, to talk more about this, we're joined by Dr. Vishakha Shivdasani, a physician, nutritionist, and author of the book COVID and post-COVID recovery. Thank you so much for joining us on the show, Dr. V. What are your tips for managing health post-COVID?
I think managing post-COVID has to happen from the time a person has COVID and not to wait till the post-COVID sequelae happens. So we don't need to wait for the complication to happen, because if you manage COVID correctly, the chances of having post-COVID complication or being a long hauler diminish significantly. So that's what I do with my patients. I start day one of symptom. And, then of course, if somebody is coming post and coming, to me for the first time as a long COVID patient, then we need to see why the problem is happening and what kind of problem and complication there is, because most complications during or after happen because of inflammation. And we are seeing an entire gamut of symptoms for post-COVID complications.
So if you could share with us, what are some of the common post-COVID symptoms or issues that people have come to you with? And, if you could tell us what sort of advice you give and you talk a lot about tweaking diets and what you take in, how important that is.
Sure. So, like I said, we're seeing the entire gamut from something as small as hair fall to brain fog, insomnia, which is very common, breathlessness, tachycardia, fast heart rate, inability to exercise like they could, to, of course, clots and heart attacks. So we are seeing the entire thing. And, while some hair fall or a hacking cough or insomnia is not debilitating and may not kill you, it affects your day-to-day activity. I could be sitting here and having an interview with you, but if I was coughing, incessantly, or my skin was really scratching, it's not a way you want to live your life. So these are real problems and they need to be tackled. So what I have done is I have come up with a 6-point plan to deal with this, which takes care of inflammation and therefore will take care of your complications, irrespective of what complications you have. So the 6-point plan, like you said, of course, covers nutrition, but also covers taking care of gut health, sleep management, stress reduction, exercise, and healing with supplements, all of which play a role in reducing inflammation and therefore increasing and improving outcomes of the complication. So specifically,
right.
If you'd like to ask me specifically, then I can tell you what's,
I wanted to actually
symptoms.
ask you, we've had a lot of young people also get COVID, and by young, I mean, between 20 to 40 years of age, and people who are very used to being very fit, people who are used to exercising regularly, and then they get COVID, and then post-COVID, they think, they can pick up from where they left off, but that isn't right, and then they struggle, and they wonder why they're not being able to manage what they could before that, and it's important to realize that post-COVID management is very important, isn't it?
Absolutely correct. I tell all my patients, don't go from 0 to 100 because you've spent 14 days in isolation with almost no activity. So don't go from there to, especially like you said, the younger people start feeling so good, and in 14 days they feel that they have no post-COVID complications so that they can go back to the gym and they are so keen to pump. We are seeing people who are just dropping dead. We are seeing people who get clots. So you need to work at it really slowly. And the exercise has to be graded every week to build your exercise tolerance slowly, even if you're feeling fit. Because the people in the second wave, especially the ones that we have seen, who've got mild symptoms or even asymptomatic, they are the ones who are left with these post-COVID complications 3 months, 6 months later. Because very often, the comorbidity is underlying. We are the diabetic capital of the world. So someone might have a blood sugar that is normal, but we don't know where the insulin levels are, which means they're pre-diabetic, or you have a beer belly, or 1 out of 5 Indian women in the childbearing age have polycystics, ovaries, and these are all comorbidities and they go undiagnosed, which is why we see the young people in the second wave who've had so many problems. So start slow, build your exercise tolerance, start with static exercises first, start with pranayam, build your exercise capacity, your lung capacity,
right.
Then increase every week. If it takes 3 months, so be it. Don't go from a 0 to 100.
Very important tip there. And you also talk about, the vaccines and care that you need to take around the vaccines. We're running out of time, but if you could briefly tell us about some of those tips.
Well, I tell everyone, first of all, please vaccinate anyone and everyone who's eligible. That's the closest way we're going to get to herd immunity. But you need to follow a certain protocol to help enhance even the outcomes of the vaccine. We need to have antibodies against the antigen, which is the vaccine. And for that to develop even further, to get good antibodies, you need to have a good protein intake in your diet, because the antibodies are formed of protein. So if you're not going to have enough protein, adequate protein in your diet, you're going to have a less antibody production. So make sure you're eating a good diet with adequate amount of protein. Most Indians are malnourished and have low protein. I'm not saying go high protein, but good quality protein and adequate protein. Make sure you sleep well, because we know that if you're disturbed sleep, even 2 days of disturbed sleep can cause immune modulation, and can disrupt your immune function. So you need to sleep well before and after your vaccination. Do not drink at least a couple of days before and after. Don't binge drink for 45 days. Do not smoke. We know that smoking causes vasoconstriction. We know that COVID is a prothrombotic disease. Of course, we're talking only about the vaccine, but still, you need to make sure that you take care of these things. Make sure your gut is good. So your immune system, 70% of our immune system is in your gut. So make sure if you have a gut problem, take a probiotic before your vaccine. So at least your gut is functioning well. So, you have your immune system in place.
Dr. V, I'm sorry, I'm completely out of time. All very valid tips and very important tips there. Thank you so much, Dr. V, for joining us on the program.
My pleasure. My pleasure. Thank you.
Well, with that, time for us to slip into a short break. On the other side, we're going to take a look at some of the frequently asked questions around vaccines. Now for our campaign, Vaccinate India, in partnership with Google, and we're bringing you questions that many of you ask online, questions that you often Google, and to answer them, we're joined by Dr. Pavitra Venkatagopalan. Thank you so much for being back with us, Doctor. Well, one of the questions that's frequently Googled by people are vaccines safe? What would you say?
Vaccines are very safe. Vaccines are safer than just walking across the road. They are tested extensively for their safety and efficacy, so please trust them and take them.
Right, absolutely, Doctor. And, what about allergic reactions? These are some of the questions that people often have. If they have allergies, is it safe to take vaccines? If they have, comorbidities, is it safe to take vaccines?
So allergies is a very different ballgame. If you have a simple pollen allergy or a dust allergy, go ahead and take the vaccine. It's not going to affect you at all. If you have a condition called anaphylaxis, which you would know by the time you get to 18, because you would be very careful about avoiding a lot of things, then you should inform at the place of vaccination that you have this reaction and what you're allergic to, and they will guide you accordingly. So you can go ahead and take it. Whether you have diabetes, high blood pressure, heart condition, kidney problems, please go ahead and take the vaccine. Because think about it, if you are worried about what can happen after the vaccine, think about what can happen to your body after COVID, which is a very scary, potentially lethal infection. None of that is going to come out of the vaccine. So please go ahead and take the vaccine without having any fear.
Absolutely. And what's very worrying now is people are becoming very, susceptible to forwards and going down some rabbit hole online, and have to be very careful about that, because there are a lot of people with a lot of incorrect advice, isn't it?
There is a lot of misinformation out there, and I don't really understand why people come up with these messages, why they share them. I don't understand the origin of these at all, because it ultimately ends up hurting everybody. Unless everybody is vaccinated, nobody is safe. And there is no big conspiracy in developing this vaccine. There is no big pharma that is trying to, do something or control people's minds or anything like that. Vaccines are safe. Vaccines have been in existence for so many years, and we have eradicated so many diseases because of them. They are one of the best inventions that humankind has made in the field of medicine.
Absolutely, and we should all take advantage of that and keep ourselves safe. Another question that is often Googled and looked up is, are vaccines effective? What would you say on that?
See, vaccines are effective. Now, what I find people getting into rabbit holes when they start looking at vaccine efficacy and look at numbers, this is 98%, this is 99%, this is only 70%. See, for a vaccine to be good enough, it only needs to be effective 60% of the time. That is called a good vaccine. And all the vaccine candidates that we have today are much, much better than that. So please go ahead and take it, because the difference in the efficacy is not worth the risk you're taking. You're waiting for that high efficacy vaccine. Don't wait. Don't wait. The vaccines that are available right now are good enough for you and me.
Right, and even if people do get the COVID infection post the vaccines, doctor, usually it is a much milder infection. It doesn't require hospitalization, and that is what the vaccines also protect you from, isn't it?
Absolutely. See, what happens when you have an infection, any infection, naturally your body starts building antibodies. But the body has to determine which is the best antibody to work against this disease. So it takes some time. So that time is when your body gets susceptible to that infection. You can have severe disease. But when you give the body the vaccine, the body has already gone through this process. So when it sees the virus, when it sees COVID-19, it's like, I know which antibody I need to release. So let me release that at the earliest so it doesn't take over my body. And that's how it prevents a severe infection.
Right, but you have to continue following COVID protocols even after you get vaccinated, and that's something we keep emphasizing.
Yes, absolutely. Until everybody is vaccinated, we have to keep following this COVID-appropriate behavior. A lot of people say, I don't want to get vaccinated because I still have to wear the mask. Just a reminder, until you get vaccinated, we still have to wear the mask. So please take the vaccine.
Right, absolutely. We need to keep emphasizing that the vaccines are effective. They may not be 100% effective, but they will prevent severe disease, and you have to continue following all the COVID protocols, and that's the only way we're all going to get rid of this pandemic. Thank you so much, Dr. Pavitra, for joining us and answering all those questions, the questions that are often asked by people online. Thank you.
Thank you.